If you suffer from dry eye, there is good news. The folks over at Newsome Eye can help you. Dr. Eric Fazio joins us today to explain what the disease is and what the treatment options that are available. Good morning, doctor. Glad to have you here today.
Thanks for having me. It's great to be here.
Yeah, we love Newsome Eye. We love, again, that kind of your campaign, what you love to tell people. People brag on saying, hey, I have Newsome Eyes. You're able to help so much.
Yeah, we take a lot of pride in that, on our outcomes and making sure that we give people those Newsome Eyes. So.
Yeah, and that's kind of the slogan that everyone uses that I love. But let's talk about dry eyes this morning, because I think this is something that a lot of people suffer with. And on the surface, it may say, oh, it's just dry eyes, but this can really bother people.
That's exactly what it is. It really is on the surface. So it really affects millions of Americans. I mean, some people say as many as 10 or 12 million Americans suffer from dry eye, which is a lot. The big issue with dry eye is really something fairly simple. It's a disturbance in the surface layers of the eye. There's really three main layers on the surface of the eye. One is a lipid layer that, in the simple way of thinking about it, just prevents evaporation, just like an oil will. The main ingredient is just a lot of water. So that's the middle layer called the watery layer. And then the back layer is kind of like a mucus that really makes it stick, because we're vertical, so water will fall if it's produced. So,
makes sense.
You know, water's produced actually up here in the lacrimal gland. Believe it or not, it's the upper lids. So if there's a disturbance in any one of these layers, you're going to have dry eye.
Does this affects people's vision? And I mean, I can imagine it can really kind of uproot and disturb how your way of life and how comfortable you are on a daily basis.
Right. So we kind of look at the way life is going and what are we doing? We're using computers, we're using cell phones, we're doing all this stuff. So what's happening is people are getting a lot of burning, pain right through the eye if it gets severe. Unfortunately, it will affect vision. That's probably my #1 reason for a patient to come in is they're working and they're saying, Doc, my vision's blurring, I need new glasses. I'm like, you don't need new glasses. You know, the surface of your eye is just breaking down. And a good example is like if you take a person's vision with dry eye and they can blink and it'll literally move from 20/20 to 2200. Yeah, in just one blink.
Wow.
So it absolutely affects vision, yes.
So if it's a somewhat I guess easy, complex, is it easy to fix? I mean, what's the solution for it? What's the good news, doctor?
Well, I think the problem with severe dry is ECPs or eye care physicians typically don't do very good with it. So you come into the doctor and what do? They give you a tear. Then you go to the pharmacy and there's 80 tears there. And you're like, what do I get? I'll get the generic this and think it's going to help. And they do it and it helps a little bit. Really, if you're going to really get a good outcome from dry eye, you have to be logical about it. So first of all, you got to diagnose where's the problem in the layer as a doctor. Okay, we got X, Y, and Z problem, and attack it. And the way you attack it is not just with palliative therapy. With tears, we do a lot of technology in the office. One of the cool things we do is something called punctal plugs, which I have because I have dry eye, and it really helps me tremendously. I don't really use drops much at all, which is a little device that goes in the tear duct. That can be done in about 5 minutes. We do a really interesting new therapy for about a year and a half now, which we talked about a little bit, which is really a little weird for people, where we draw their blood and we spin it in our sterile center. We have all the licensing for this to be able to do this on site, which is really cool. And you use that serum in an eyedropper twice a day, and it works fantastic.
It's essentially stem cell kind of therapy?
Really, it is. You know, it's called autologous tear serum. All that means is the donor and the recipient are the same person. That's all that what it means. But it's very natural, as you can imagine. It's not drugs or chemicals.
That's kind of the future of medicine. So that's why we were talking the commercial break that I was surprised to hear you can treat it for dry eye.
But for very severe cases, there's more advanced therapies where you use literally amniotic grafts against the eye. And I've done a couple of those even this morning, actually, believe it or not, on patients before I got here. And they work for more severe cases when you really have patients that could really have serious vision problems from the disease, believe it or not.
Well, again, the good news is, as we kind of wrap up here, that there are a lot of solutions. You just really need to make sure it's diagnosed properly, right, from what I understand, and then you look at what your options are.
That's right.
All right. Well, thank you so much for being here, doctor. Again, we always love when you and your team are here. If you have any info, there is their number to call. They have a great website as well, and we look forward to seeing you and your team back soon.
Thank you.